When life gives you lemon.
To my friends, to my family, everybody's screaming out there, like, how do we cope? How do we cope with this? And nobody really got answers for them. And how do you cope with this? Because as you said, the grieving process is different for everybody. We all go through it differently. We go through the stages differently. And for me, doing this is to get that hope out there, for the businessman where his business has crumbled and he's sitting with a mountain of debt and he wants to end his life. For me, it's getting that hope out there. There is hope. And for that father that has lost his job and he doesn't feel that he's man enough anymore because there's a mountain of debt and the bills just start accumulating and they are so close to losing that hope. It's getting that hope out there for them. For that young girl that I spoke to the other day who's lost her mom, an entire support system, and she's saying, how do I deal with this? How do I move forward from this? Does grief get any better? And my answer to her is, grief is a journey, and it's a process that you will have to go through. And there's certain things about it you will have to make peace with on your own. So it's not like a quick fix. Grief is not like a pill that you take overnight and you find the next day. And I think, like, and even speaking to my cousin sister who was a nurse half an hour ago, they are going through so much in the hospitals at the moment. They don't even have PPE. They don't even have the mask. They are emotionally exhausted, emotionally bankrupt. We know for sure that the vaccines are not going to be out and we're going to be into a third wave. And for me, it's giving that hope to the nurses, giving that hope to the doctors, because we realize and we know that if you've got a strong mind and if you are emotionally full, you can conquer anything. The world is yours for the taking. But if you have lost the battle in your mind and you've lost the hope in your heart, then you've actually lost your will to live. So for me, it's like the third wave is coming, and we know we're going to lose a lot more nurses and doctors in the medical profession. We know we're going to lose a lot more family. But how do we keep hope alive? How do we give them that hope that they're going to be fine? So I'm just going to mute myself, and anybody else that would like to contribute, they can. Yeah.
Amazing how our doctors and nurses have gone through so much. Okay, I know a few that have come forward and have been able to speak up, but they have to have, I think, not even iron. I know friends of mine that are in those wards who aren't even eating or going to a bathroom an entire shift. Not because of fear of COVID, but purely because they feel that they need to get the job done properly. And then I have others who are on shift, some of them overseas in the UK and USA, who don't go back home. They literally live, there's this makeshift hostels in the hospital for the nurses and stuff, and they speak to their family via video call daily. Only because of the fear of going back out into the society and then getting to the houses, and then they infect their families. And you can but only imagine that if we on the outside are feeling as much pain and heartache as we feel when we're losing one or two, we're losing them because these are people, and we're hurting because these are people we love and because we have bonds with these people. But can you imagine what a nurse or a doctor has to go through when you do this, like every half an hour, you're declaring somebody's gone. And then you have to face a family that you have to tell that to, who then blames you for some reason. I have 15 nurses that came to me in the past week, and I'm busy counseling them now because they don't know how to deal with the families that they speak with. So the actual fact of coping with one of your patients who's passed on, I think when they're going through their internships and stuff, they kind of brace themselves for what that might be like. But nothing braces them for the quantity and number of deaths that they have to face today. But right now, what they're facing is a little bit worse. And that's the comeback from the families that they have to go back to speak to say, but so-and-so has passed on. because the families are blaming the doctors and blaming the nurses. Why? Because the families are not allowed to see this, the patients once they're in hospital in COVID wards. So families are relying on either a video call or relying on somebody on the inside, and the hospital is giving them feedback. So when you get the call to say someone is passed on from being positive in hospital, you lash out immediately. And who do you lash out to? You lash out to that nurse or the doctor is giving you the bad news. But you don't realize, what are you doing to that person? You're killing that person inside, because that person's already feeling that guilt. She or he is already feeling like, what could I have done more to save this person? Now you on top of that are going and telling them, but it's your fault. What did you do wrong to them? So nurses and doctors are having this compounded effect of guilt. And what's happening with that is they're starting to feel guilt about going through the next. So they're becoming more like, I don't want to do this anymore. I just can't do this anymore. So they, as much as the heart and soul of them wants to be the nurse, wants to be the doctor, wants to be the paramedic, wants to be the police officer, the feedback and the desire is not what's paramount anymore. They're just tired, physically tired, mentally tired, heart is tired. And that's because we don't know how to cope with the loss that they have had to endure in the hospital. So when we have to talk about death, and we have to talk about losing so many, like Corinne just said, she lost so many of her pillars so quickly. And that too was at when her baby had to be born. I can but imagine that you also must have felt a little bit of guilt. You must have also felt a little bit of anger. There must have been a little bit of anger inside you saying, well, how could you do this to me now of all times? I'm having a baby. How could you take her away? That's my father. How could you do that to me now? And that's natural. The one thing we need to understand is when we're feeling these emotions, don't hide it. Don't try and become the strength of something that you're not, because you are human. And the pain that you have to encompass and endure is human. Embrace the pain. Embrace the pain, because when you embrace the pain, you're actually saying to your higher being, I know this is from you. I don't have answers. Only you have them, but just help me to get through this because I don't understand. So what you're doing is you're converting that anger that you actually have into the, I don't understand, so just hold me. It's almost like, when you want somebody to hug you and you need that feeling of solace in a hug, that's you yearning for somewhat of an answer. But remember, when you're losing those that are that close to you, that are paramount to your support structure, there's no replacement. It's not like if I lose this pen, I can just go and find another one that's going to write now. It's not the same. But how you cope with what you can control, which again is in your mind, it's in your heart, and it's in your belief system, it's in your hope. That's where that's where the core of you in your lifespan and your journey goes. And that's why, Corinne, what you answered your friend was perfect. To say to somebody that grief is a journey, it really is.
Yeah.
If there's one thing I disagree with that people always say to everybody else is give it time. There's no such thing. There's no such thing as give it time and it's going to get better. No. I know I lost my grandfather, for example, like 12, 15 years ago. I walk into a mall and I see a grandfather with their granddaughter still today, and it hurts me. So time doesn't take it away. If anything, if you don't learn how to cope with it, every time you're going to see a mother and a father, every time you're going to see a granddad with their grandchild, every time you're going to see anyone out there, it's going to trigger a memory. And if you're not going to know how to cope with it, then each time you're going to see that, it's going to create an influx. And what happens when you keep building on that influx? You're going to actually just compound it. Then you're going to start having physical issues with yourself, which amounts to depression, which amounts to anxiety. And then you're not going to cope with anything else that comes after it. But it's good that we have to talk about this, because again, when you talk about it and you get other people's viewpoints and you get how other people are actually feeling what you feel, it's amazing how just knowing somebody else went through something similar to you makes you feel like, okay, somebody else can relate. As opposed to you sitting in your cocoon kind of, and you feel like, how could this only happen to me? then you're going to start feeling like the world is out to get you. It's not about that. So when you relay your experiences and when we're able to actually voice them and others are able to voice back to you and you build this team of people, that is why, for example, you have lots of different group sessions of different people who are addicts for certain things. Why? Because somehow to familiarize yourself with somebody who's gone through the similar as you makes it easier for you to cope. The same thing is with grief. When you meet and you feel and you are with people that are going through something similar and you want to bring up the hope, you want to bring up the gratitude, even in that face of adversity, there is something to be grateful for. When we start to learn that, then you realize that you're not controlling the universe, you're controlling you. There's another higher force controlling everything else. So take control of you, take control of your emotion, take control of your mental health, take control of you and your unit, and then start to build on that. Once you build on yourself and you build on your unit, then whatever comes from outside of that, you're able to learn, okay, it's outside of me, this is how I need to learn and cope with it. I know it sounds like, Marine, this is so easy for you to say. It is easy for me to say, but it works only because I lived through it, I've been through it, and I can relate to it. There's one thing you learn about me as you find out more about me is, as much as I've studied the psychology, etc., what I give off when I teach in all of my lectures, when I do my workshops, is not textbook theory. I don't give off a theory that I learned in a textbook. They're all important. Yes, it's very important to study these things. But what I give off are my life experiences. Why? Because it's human nature that people will relate to me humanely. It's one thing to have to stand in front of somebody who's able to tell you, here's the do's and here's the don'ts of life. What are you going to take back with you? Nothing really. But if you talk to somebody and somebody's out there telling you, this is what I have endured, this is what I've been through, I know how it works, and this is what worked for me, the humane factor in you is going to reach out and say, okay, I resonate with that humaneness in you. Why? Because that's human nature. We like to relate to each other. We like to resonate with what the other's feeling. I was crippled. And that's not me giving you a theory. I really was. I was crippled and they said, I'll never walk again. They said, I'll never have a child. They said, I won't be able to do A, B, and C. I'm a mother. I walk, I drive. So I know when I'm speaking about the mental capacity and mental health and how it can really be your boost and your engine for you to push yourself forward. I'm talking from my own experience. Somebody who was lying in a bed, bedridden, told by 4 different surgeons, I'll never walk again. I walked. I'm walking today. So I know that a lot depends on how we view things, how we perceive things, how we take in what is from outside and what we do with it inside us. This is why I was saying it's a lot to have to try and cover in a short space of time. But if we try to understand and grasp where this is coming from, each one of us separately. If there's Shelley and there's Ezra and there's Corinne and I think there's a Leon, I'm not sure, I can't see too many names, but if each of us has to take a 5 minutes and you sit and you think back and you say, well, okay, these are the things that Marianne said today. Which part of what she said resonates with me the most? And what part of what she said is it that I have questions on? Because remember, one of you might say, yes, she's saying this and I can relate. I like what she's saying. Somebody else might be saying this, but how can you say that? I lost somebody so close to me. How can you tell me that's outside of me? Please ask me. And then let me clarify it for you. Because unless you're going to be able to do that with me, you're not going to really get the core gist of what I'm trying to teach you. So for each of us, the different mechanisms work differently. But today's session was for you to know that I'm coming from the humane factor, not from somebody who's lecturing you. I'm coming from somewhere who's experienced and somebody who wants to build that hope for each one of us. And each one of us can then be the catalyst to take that hope outside. Because it starts with one, like I said before. If each one of us builds the gratitude, builds the love, and builds the hope, and we can take it forward, then each one of us is able to make that difference for someone else. And then Corinne doesn't need a Marine. The Ians work very well. But the Korean can take it forward and do it with somebody else. And that person will take it to somebody else. And that's how it can just have this catalyst effect. And we can have, every one of us can learn how to cope with this thing going forward. So please, each of you really take cognizance of what I've said. and put it together in a little bucket and think of what is it that I've said that resonates with each of you separately. It's not going to be the same for each one of us. A message that's going to work for Ezra is not going to work for Shelley. A message that's going to work for Shelley is not going to work for Kareem. So something that I've said is hitting home with someone. I'm praying and I'm hoping. But that is what you sit with and that's what you work with. And then you're able to pose questions. And please, all of you are welcome to get my number from Corinne and WhatsApp me your questions, or WhatsApp Corinne the question and she can collate them. So by the next session, we'll be able to have all these different questions and I can then work with them with you. And we can all just work with each other, and that's how we learn going forward. Does anybody else want to share anything?
Don't forget to join us on our Facebook page and our YouTube channel for more exciting content and relevant videos.